We must therefore continue to operate in this virtual fashion using public guidelines outlined by the Attorney General.
Can't hear them.
As a refresher, the public comment rules we will follow today are at the beginning of the meeting, the council staff will read the agenda. The agenda is also online at council.nola.gov. Anyone wishing to comment on any agenda item should go to that site, council.nola.gov, and fill out an online public comment form. Only written public comments will be accepted. Public comment will be limited to 1 comment per person per item. Comments should also be limited to 2 minutes when read aloud and be germane to the agenda item at hand. Public comment will close at the end of a 10-minute public comment period. This will be announced and no written comments will be accepted beyond that point. Before voting on an agenda item, council staff will read any public comment received for a pending agenda item. So with that, sir, would you please read the agenda?
Presentation of update cemeteries, update changes, Item 6, community safety presentation by Executive Director of Community Safety. The programs and opportunities for youth safety presented by Chamber. Item 7, Foreclosure Registry. Ordinance requiring financial institutions to register properties placed in foreclosure, assume responsibility for maintenance, and assign a property manager for a foreclosure period presented by Nicole Hyman, Director of Community Assistance. And agenda item 8.
Thank you, sir. So with that, we will take a 10-minute break to receive public comment. If you would tell me what time are we going to reconvene? 11:19, and we will be back. So we'll stand down for 10 minutes to get public comment. So see you all shortly. Thank you. Good morning, folks. We have had the required break to receive the public comment, and we will now continue with the agenda. We have a presentation from Dr. Vegno relative to the initial vaccine rollout. Dr. Vegno?
Thank you, Councilmember Banks. I am trying to figure out how to turn my video on.
Well, I'm not the one to ask.
I believe Paul is working. Oh, here we go. Okay. Thank you. Thank you guys for having me here today. I don't have a formal presentation, although City Council staff did put together just a few slides with some information from LDH on vaccine. So we can do that. Yeah, thank you. You can go to the next slide. I just want to start with reminding everybody where we are right now in terms of the pandemic. We are in a very, very tough place, as evidenced by our very high cases, our hospitals being full, and our percent positivity rate being quite high, which necessitated, unfortunately, restrictions that were put into place last week. I do have confidence, and if New Orleanians have done this before, I have confidence we can do it again. But as we talk about vaccines, you can't get a vaccine if you're not alive to see it. And so now is really the time where we have to double down to get through this period so that everyone in our city can get a vaccine, because that is our way out of the pandemic. And we also know that mass vaccinations do not work as well when you have a raging epidemic happening at the same time. We need to get our levels back to what they were for many, many, many months earlier in the fall. And when we do that and we vaccinate everyone, we will be back to normal much, much quicker and in a much safer way. So just want to put that out there. Let's talk about the vaccines themselves really, really quickly. Right now, we have 2 emergency use authorized vaccines in the US that are actively being given. I haven't seen the most recent numbers, but it's close to 10 million, if not more, doses of both the Pfizer and the Moderna vaccine that have been given all over the country. With really no severe side effects, resulting in hospitalizations or deaths. That is a pretty amazing feat. Both of these use messenger RNA technology. And while these are new vaccines, that technology has been in development for years and years. So it's not something that just was invented for COVID. It's just that COVID presented the opportunity to put a lot of resources into nothing but testing and developing these vaccines. That's why it happened so quickly. They were approved by a number of scientific bodies who have no governmental or political influence, and the conclusions were strikingly similar for both. What we know about the Pfizer and the Moderna is that with a 2-dose regimen, 95% of symptomatic infections were prevented. That is far greater than a lot of the vaccines that we commonly get, like the flu shot. So it's pretty, it was more than we hoped for, quite frankly. They were tested in thousands and thousands of people, all adults, with varying medical conditions and varying, from varying demographics. So we have a really good sense that this works for everybody. And again, the side effects were minor. Now, lots of people have been getting side effects like a sore arm or an achiness or body aches, that sort of thing. But they generally last a few hours to a day. And again, even the allergic reactions we've seen have been quite rare and have not resulted in any serious outcomes. So public health officials agree that these shots are safe. They are only approved right now for adults. And I'll go into the priority groups. They are currently being trialed in children. In fact, there are children in New Orleans right now who are bravely participating in trials so that hopefully we can extend that. There are a few other vaccines in late stage trials that we hope to have approved as well, to add more to our armament. We have to get, most public health experts agree, at least 75 to 80% of our population vaccinated in order to end the epidemic and go back to life as normal. That is at least 300,000 people in the city of New Orleans. And remember, right now we have to give them 2 doses. So it's a pretty daunting task, and we don't have enough to do it all right now as we wish we did. That's why the CDC and medical bodies have come up with a priority list that each governor is choosing to follow. Our governor is sticking pretty close to that priority list. They are designed to vaccinate those first who have the highest risk of hospitalizations and death, or the highest risk because of the job they do. So right now, and this is a slide from the State Department of Health, statewide, we've opened up vaccine for phase 1A. That is frontline hospital personnel, ER doctors, nurses, janitorial staff, food service, all of those who serve patients in our acute areas where we know COVID is very, a high rate. Also, our nursing home, our long-term care facility residents and staff have begun, because they have by far suffered the most from this pandemic. And so they have been prioritized. And then first responders have been prioritized as well. Last week, the governor expanded, and we were all really glad he did, to, while we're working our way through phase 1A, to also accept another priority group, and that is individuals 70 years and older. Again, they have the highest risk of complications, hospitalizations, and death. So what I've really been excited to see is our seniors absolutely wanting this vaccine. The demand is huge, and that is I think a recognition that they are at risk. They want to get back to normal just like we all do. Other folks that are vaccinated now are, again, any healthcare worker that is interfacing with the public, those who do home health, dialysis, and others. I don't think the slide is in here. The next group that has been identified is a pretty broad group. It includes school teachers, it includes transit workers, correctional workers. It focuses on those frontline essential workers who have a lot of interaction with the public and are at high risk. We've been told that we will not have enough supply for those groups probably until the beginning of February, but we are actively working on plans to make sure we get as many of those groups as possible. Would you advance the next slide? Whoever's advancing, thank you. So we talked about this a little bit. Do you want to go to the next one? So let's talk about, where we are now in terms of the groups that we're doing, getting our seniors vaccinated. Our healthcare systems, the main healthcare systems, Ochsner, LCMC, and Tulane, have all been vaccinating their seniors within their population, and they are trying really hard to ramp up quickly to take as many seniors as possible, whether in their system or not. A few of our clinics have received vaccine and are doing their population, and some have extra doses. Not one single dose wants to go to waste. Everyone's focus is on getting every dose used so that we do not want to waste it. So sometimes it may be that a hospital or a clinic has some extra doses and they frantically try to call seniors or appropriate personnel to get them in. Pharmacies are also in limited fashion able to give doses to people 70 or older. It is not every pharmacy in the city of New Orleans. The state of Louisiana has identified pharmacies. They expanded that list yesterday. I believe it is 12. And they're scattered all over the city. For the most part, they're pretty well geographically distributed. Some you can call if you're a senior and get on the list. Others are online. Again, it's not sufficient for what we know the need is. And we know there's a lot more work to do to get to everyone who needs it in that 70 plus group. We urge everyone to go to NOLA Ready and look for the vaccine page, and that will help you find out what's available for you if you are a senior. you want to go to the next?
No,
Next.
before you move
Yeah.
on, something for me.
Sure.
If there's an instance where a entity has vaccine, but they don't have enough of the designated category, is it okay for them just to give it to anybody rather than let it go bad? Or do they have to wait for, if they're 70 years of old, if they can't find enough 70-year-olds, what do they do with it? And can they use it instead of letting it go stale?
So they're really trying to stick to the guidelines. So they have waiting lists in many cases. So if, I'm thinking of some elderly folks that I know. They had an appointment that was scheduled for a week out, but then all of a sudden they got a call and they said, hey, we have extra doses today. Can you come in today? Absolutely, I can come in today. So they're trying to push people up on the list. If they have extra doses, they are going to units in the hospitals and saying, who didn't get vaccinated? We've got 2 extra doses, come now. That seems to be working. What we don't want is sort of this free for all where, a healthy 20-year-old gets it when really we could have just called, the next senior on the list and gotten them in and protected them a little bit better. So they're really, really trying to stick to the guidelines.
Okay.
And the next slide just shows what I've been talking about, sort of where right now things are. I will tell you that at the city, we have been working for months with our healthcare partners and the state to expand access. It is very likely that soon we will have in each parish a drive-through vaccination location or locations that will, again, start right now with 70 plus and be appointment only. So not just everybody coming through, but then use those as a model to ramp up. What we've also been doing is working with the state and LCMC in particular to develop strike teams where we can go to places, large places like high-rise apartment buildings that have a lot of seniors in them and do everybody on site. We've done that very successfully with our community-based testing. However, vaccine logistics are a lot more complicated than testing logistics. So we won't be able to go to a different place every week and in small, tiny places. So what we're trying to do is be as efficient as possible, stick with our larger places, but then see if we can have smaller groups feed in. Our goal is to provide the same level of access to vaccine that we did with our testing, because again, we cannot afford to not vaccinate any corner of the city of New Orleans. Let's go to the last slide, or the next slide. That might be it. So we've got a great communications campaign, and I do want to, to say there has been a lot of concern about this vaccine. There has been a lot of miscommunication. It has been a very challenging process to see it get rolled out. There is hesitancy that is real and is grounded in long-standing mistrust of medical systems and governmental systems that have failed a lot of people and done things in the name of science that were absolutely tragic. It's our goal to be as honest and transparent about the vaccine so that people understand and have all the facts and understand what it means to them and their family. I took it myself. I've gotten both shots. I will be, I have felt great. I have read every document on the safety that I possibly can, and I feel very comfortable speaking to that. But it's important for us to hear the concerns of residents, talk with them honestly, ask them what we can do to help educate better, get the word out. And so our excellent communications team at NOLA Ready has been doing some fantastic campaigns. We've been doing a ton of town halls to everyone all over the city. And so, we invite residents to talk to your family, talk to your friends, ask the questions, talk to your trusted healthcare professional. This really is our way back to normal, but we want to make sure that everyone feels comfortable doing it. So with that, I'm happy to answer questions, or if there's things I haven't touched on, I'm happy to do that as well.
Doc, I've got just a few questions, and these are more logistical, just for clarification. Of those in the designated category, at this point, 70 and above, what do they need to have or to present when they get the shot, other than just be 70 years old?
That's a great question. So these shots are free. You will not be charged for the shot. Depending on where you go, You might be asked for your insurance. That is purely for that organization. You will not pay out of pocket. Some insurances might cover some cost at some point. That's a little bit up in the air, but you will not incur any cost. You may be asked for your basic demographic information, your name, your birth date, your address, that sort of thing. That is to put you in the immunization system. Basically the same information that when you get a flu shot, you have to write down. That is not going to be given to anyone or used. It's purely so we know that when you come back for your second dose, you are in our system and you are the right person coming back to get it.
And is there a residency requirement? Is it just, can someone in Orleans go to Jefferson to get a shot or vice versa?
So right now, yes. Right now, there is not a particular residency requirement. And again, we are all one region. So just like with testing, the more we can help and test our neighbors and they can help us, the quicker we'll get through this.
And it doesn't matter if you live in Uptown, you can go out to the New Orleans East Hospital, or if you live in New Orleans East, you can come uptown to one of the facilities. It doesn't matter, wherever you go, you are open and eligible to go and get the vaccine.
So the hospitals have started by calling all of their patients first. So if you're an Ochsner patient and you're 70 plus, they will have reached out because of course they want to keep everybody in their system. So have the other hospitals, but they are very quickly working to expand that. And certainly at the pharmacies, it doesn't, if the pharmacy's uptown, but you live in Gentilly, that doesn't matter as long as you can get there.
And is there a schedule of these tiers that are coming so that someone who is a XYZ demographic can know that they need to be getting prepared in middle March or late February or whatever it is? Is there a schedule of the projected tier dates?
Yes, it's on our NOLA Ready vaccine page, the next group. And like I said, the next group includes a lot of frontline essential workers. We do not know yet what the group is after that. And I will say this changes rapidly. So you might have seen the headlines today that the federal government is asking states to go down to 65 and include some people with pre-existing conditions. That's not currently any of the tiers, but it may be likely that our governor chooses to follow that advice. And so we could be here next week talking about 65 instead of 70. So if everyone can just sort of sign up to NOLA Ready and keep checking the page, both our page and the Louisiana Department of Health page, when things change, we will do our best to notify you, but you can stay in the loop that way.
And please, just to clarify that, the guidelines as to who is actually eligible now is not being driven by the city, but we're taking those directives from the state.
Yes, and that's true of every state around the country. They set they take the federal recommendations and decide whether or not to adopt or change them slightly for their state, and then they get the vaccine and the states push them out to the municipalities.
And this is going to be obviously a massive undertaking that's going to take a while. And the Zulu Club, Plata Temple Shriners, Rho Phi Chapter of Omega Psi Phi Fraternity, the Drives YMC, all of those folks have reached out to me asking how can they help. So at what point, or will there be a mechanism for volunteers to be able to come facilitate this process?
Yes, there already is. We have two ways to do it. We have our NOLA Ready volunteers. Again, this is all on the website. You can go on, you can sign up to be a volunteer and you'll get more information. If you have a particular medical background, and you don't have to be a doctor or a nurse, maybe you are a public health student, maybe you're a social worker. We have our Medical Reserve Corps. Both of those groups are going to be hugely important when we start doing larger vaccination efforts. And we've already begun scheduling and training and making sure they have everything that they need so we can hit the ground running.
And then, Doc, my final point at this point is I want you to clarify exactly what the vaccine will do. The vaccine is not a cure. So would you clarify for everyone listening exactly what the vaccine does and doesn't do?
Yeah, I probably should have started with the science. Thank you. So what the vaccine does, it is not the virus. There is no part of the virus. It is what messenger RNA. What that is like an instruction manual. Every cell in your body has RNA, and it tells your cell what to do. So when you're getting that shot, it is a little tiny piece of RNA that goes into a cell in your body and tells that cell, make this spike. If you've seen a picture of the coronavirus, it's a circle with little spikes coming out. Those spikes are how it attaches to your cells and invades your body, basically. So the vaccine tells your body, make a spike. When you make a spike, it presents it to your body, and your body says, that is not normal. That is an invader. I'm going to study it and figure out what I need to do to prevent this invader from getting in my body and causing disease. So when you do that, if you're exposed to the coronavirus, if you've had the vaccine, if the coronavirus enters your system, the vaccine says, oh, wait, I know what this is. I'm going to fight it, and you're not going to get sick. So we know that the vaccines prevent us 95% in the trials from getting sick with COVID. We don't know yet if it prevents us from getting COVID altogether. We don't know yet if it prevents us from giving COVID to someone else. That's why we all have to get vaccinated. We will learn more. We will learn about, does it not only protect us from getting sick with COVID, but does it protect us from being able to give it to anybody else as we go through these trials? But again, this is not the virus itself. This is similar to other vaccines like the flu shot, the tetanus shot, the pneumonia shot, in that it helps your body recognize and respond. That's why when you get the vaccine, you might feel some side effects. You might feel kind of cruddy. That's your body working. That's your body doing its job, recognizing what it thinks is an invader and fighting against it.
And I guess I went down that road just to reemphasize to everyone, even after you get the vaccine, it is still imperative that we wear a mask, social distance, and wash our hands, because this is not the end of the story. This is getting us to the end, but it's not the final chapter of this. So everyone needs to be very intentional in making sure that these precautions that you're taking now, you continue to do.
Right. I've got my mask here. I have not changed anything that I am doing. I am following every one of the guidelines, and I will do that until we get to that magic 75, 80%, and then we can all take our masks off together.
Well, ideally, we will do all we need to do to make New Orleans the absolute first city, not only in the United States, but hopefully in the world, that'll have everyone inoculated. We need
That's our goal.
Our life the way that we're used to. We had to put a lot of stuff on hold, but hopefully we will get enough folks vaccinated that we can get back and be the first to get back to life as we knew it. I see Councilmember Wynn. Councilmember, you had a question?
Yes, I do. Dr. Avegno, when they come for the vaccine, I'm assuming that they have to be in good health as well. So if they had like a cold or a fever, they would not be able to receive the vaccine. Can you talk a little bit about that?
Yeah, that's generally the recommendation for all vaccines, and not because, if you have a cold, the vaccine's going to give you another virus on top of it. That's not how it works. But generally, if you're not feeling well and you get a vaccine and you have additional side effects, well, that just sort of makes it worse. So if you're not feeling well and you're scheduled to take the vaccine, I would definitely have a conversation with your doctor to see. If it's just a minor cold or allergies, they might say, go ahead and get it. Obviously, if you're sick with, something else, then you should probably delay it.
Okay. But are we going to issue the vaccine if they're not feeling well, or are we leaving it up to the resident to decide?
I think we would have a conversation with each individual person. If that person presented to a vaccine site and was not feeling well, then probably the provider on site would have a conversation with them and decide what the best thing would be to do.
All right, thank you.
Any other questions from colleagues? With that, do we have any public comment? All right, no public comment. So with that, Doctor, I really appreciate you taking the time. This will not be the last time we do this.
I hope not.
Hope
Thank you.
highlighted and focused at every community development meeting that we have. This is of the utmost importance. I don't think New Orleans has ever faced something, even with Katrina, as more serious as this. And we will be intentional on making sure that we spread as much information possible to have everyone in this city to be able to have the tool they need to protect themselves. So Doc, again, thank you. And again, our goal is to have everybody in this city inoculated and to get back to life as we know it. So with that, thank you. Kristen, did you have anything? I see you popped up.
Yeah, I did. Thank you so much. Thank you, Dr. Begno. I know you mentioned that one of the goals is to have the drive-through inoculation. Do we have any timeline when you think that's actually going to happen?
We're really dependent on the state. And I will just say this, you know, they are doing everything humanly possible and more to try and get doses out as quickly as possible, but they are beholden to the federal government and they don't know how many doses they're getting week to week until a few days before. So it's making it very challenging to plan. They would like all of the parishes to have a drive-through within the next few weeks. And so we are actively planning and we will be ready to go. You know, it could be as early as 2 weeks. So we had a good call with Jefferson Parish and St. Bernard, and, you know, everybody is going full steam ahead. So when LDH knows that they have the doses that are available for the drive-through, we'll be able to implement.
Awesome. Thank you so much.
Okay, colleagues, anyone else? With that, Doc, thank you so much. And we'll see you again soon. Moving on with the agenda. Next, we will have up the Executive Director of Hanno, Ms. Yvette Hester. And Ms. Hester is going to be joined by Shelley Smith, Deputy Executive Director, and Gian Jordan, the Director of Development and Modernization, relative to affordable housing. So Ms. Hester, good morning and welcome.
Good morning, and thank you all for inviting me to this important forum to share with you our preservation and expansion efforts in affordable housing. It's hard to follow the Dr. Fauci of New Orleans, but I'll give it a try. As you all know, we are charged with not only preserving the affordable housing that we have in our inventory, but also expanding it. And today's discussion will focus primarily on the expansion of affordable housing and the tools that we use and the partners that we bring to the table to help us expand affordable housing and where we are with some of our projects. Ms. Gian Jordan, who is our Director of Development, is here to provide more granular details about the process and where we are with each project that's in the queue right now. Next slide. This slide is a representation of all of the affordable housing in discrete projects in each council district. Next slide. Currently, there are 20.
I have a question. I'm sorry, Councilmember Banks.
Yes, ma'am, go ahead.
I'm sorry. Should we ask questions during it or would you prefer after?
I don't think we have a script. So if you want to jump in, I'm sure Ms. Hester will be more than willing to answer your question now. So please.
I'm sorry, Ms. Hester. Thank you so much. And thank you so much for being here. And please forgive me for interrupting. I'd like to go back to the other slot. Yes, that one, your portfolio. Could you explain that? Because I'm sure if the public is watching this, they're going to think, wait, you mean there's no affordable housing units in District A or District E?
Okay, so these are the affordable housing communities that we are affiliated with, where we have physical units that we are responsible for either directly managing or using a third-party manager. So we have 10 discrete communities in the entire New Orleans city limits. Those communities are listed under the community name. The first number that you see under the unit count represents all of the units in the community, and the numbers in parentheses represents the number of public housing units.
Got it.
Now, it does not mean that you don't have any affordable housing units in District A and District E. We have a number of Section 8 assisted housing units in those districts. I don't have a slide for you there, but I can tell you that District A has 1,765 affordable housing units that are assisted with the Section 8 program, and District E has over 5,000.
Great. I just wanted you to clarify that for the public. I know you know that, and Councilmember Banks does. I just want to make sure that the public understands it, that there's affordable units throughout the city.
Yes, there are. And listen,
Not enough. Let's be clear. Not enough.
Not enough. And we need to populate districts A and E with some discrete units. So that's our goal.
Great. Thank you.
All right. All right. Can we go to the next slide? And so we have over 4,877 affordable housing units in these discrete projects, of which 2,188 are public housing units. We have about over 18,000 families that are on the public housing waiting list. And in our Housing Choice Voucher program, we have the capability of serving over 18,000 families with rental assistance in that program. We have roughly 23,000 families on that waiting list, and we have another 27,000 families on what is called a project-based voucher, which is assistance tied to a specific unit in a specific location. So if you were to combine all of the waiting lists, we have roughly almost 70,000 people on the waiting list for affordable housing in the city of New Orleans. And that is a representation of the need of affordable housing in this community. Next slide. Yes, I'm sorry.
1,000 folks on the waiting list. Where are they living now?
Some are living in private housing. Some are living with relatives. You know, they're living all over the place. So they're living in private housing with relatives. And some may be living with a family member living in public housing or affordable housing.
But we can't emphasize enough that there is a desperate need for more units to come online to expand the opportunities for people who are working to be able to live in the city. And with the waiting list of 70,000, that should get everybody's attention that we are woefully short in what we have available. So everybody ought to be intentional about doing what we need to do to get more units online and available.
Okay, thank you. Next slide. And so in 2020, we produced in a partnership with some of our developers, 190 affordable housing units, of which 159 were assisted through the project-based voucher program. This is not where we need to be, and obviously COVID has affected some of our development activities, but going forward, we have a very robust program that will produce more affordable housing units over the next 3 years. Next slide. So this chart represents the number of affordable units that we are working in partnership with developers. We use our project-based vouchers to leverage other resources so that we can get more affordable units in the pipeline and in inventory for people to lease up. In 2021, we project to have over 1,500 affordable housing units available to families, of which 930 will be project-based vouchers. And this chart represents the project, the estimated date of completion, and the unit count. Next slide. And then there are Hanno plan projects where we have a direct investment in. And you'll see that in the next 3 years, we plan to have almost 1,000 affordable housing units in inventory available for affordable housing residents. And we are working with a number of developers, and we have a number of units that will be coming online at various points over the next 3 years. And at this point, I just want to pivot to Ms. Gian Jordan, who can give you an update of where we are with each one of these projects. Gian?
Good morning, council members. I apologize. I'm not Kanisha Ross. I am Gian Jordan. Just wasn't able to get on from my computer. With Lafitte 2017, right now we have a total of 23 units that will be under development. 18 of those will be project-based voucher units and 5 will be tax credit units. The developer right now is waiting to determine if they've received funding. They submitted a city NOFA application in November. So we're waiting to hear back from them if they've received funding yet. We don't know of the time frame. The city has not announced that date yet, but we think that'll be in the next couple of months. Winn-Dixie Phase 2, a developer decided not to submit tax credits in 2020, so he is looking to submit for tax credits in 2021. Right now, they are regrouping and redoing their performance and their numbers and starting again to secure most of their financing, including submitting a tax credit application. And we're not sure just yet if that's going to be 4 or 9% credits, but it will happen this year. With Maisant Royal, we're looking to do 136 units there, 28 of which will be tax credit units, 54 will be project-based voucher units, and 54 will be market rate units. Right now, they're in the final phase of the Section 106 process, and they're working to finalize the last draft of the memorandum of agreement between Hanno, FEMA, SHPO, and LHC. Our next meeting, in fact, I'm sorry?
I'm sorry. I know this one is near and dear to everybody's heart. Do we have more of a timeline of when that might occur?
We actually have a meeting with them on tomorrow, so we'll know on tomorrow where we're going to be with those units. But really, it really is now everybody agreeing to this last draft of the MOA.
Great. And if you don't mind, after that meeting, if I could get a brief update. I know y'all are busy, but I would just like to know the status.
Sure.
Thank you very much.
Yeah, I'll make sure you know what happens after we meet tomorrow morning. But if everything goes well, we are expected to start construction probably toward the end of 2021 with completion by 2023. With Christopher Park, we're anticipating doing 216 units, 54 of which will be project-based Section 8, 90 tax credit units, and 58 units slated for 80% of AMI and 10 market rate units. It's going to be a mix of 1, 2s, and 3 bedroom units. We conducted a community meeting on December 9th, and we did another follow-up meeting with residents there. Right now, we're finalizing the design, and we hope to, and we based on the feedback that we've gotten from those meetings, we're looking at storage and green space and parking, and so we should be finalizing that design fairly soon.
Can I also, again, I'm sorry to interrupt, but this is another important one in my district. Could I please be briefed and look at some of these designs before anything's finalized?
Yes.
Because I know that's not a controlled district like with HDLC. So design is going to be really important in this area.
Mm-hmm. So I'm thinking by the end of this month, they should be pretty close to completing their construction drawings. And then they would submit for a 4% tax credit application. And we're thinking it's going to be early spring. And so our estimated start there is going to be roughly around end of spring, early fall, with completion also by 2023. When you look at, they'll probably be on a 15-month construction schedule.
Great. Again, I just want to stress, I'd like to be able to see these designs beforehand. Remember, we ran into that problem with Maisant Royal because all of this was done prior to any kind of community engagement. I hear that y'all have done community engagement. This is great, but I really want to make sure that we have a very forward-facing design, and that's good design for the tenants as well as green infrastructure. because that area has now been kind of, it's a total clean slate.
Is there anyone you want me to speak to directly, Councilmember Palmer, to get these?
In my office, please, if you could communicate with Andrew Sullivan. And then I would also like to know who within in the surrounding neighborhood y'all have met with. And then maybe we could get on board too, like AEDF.
Okay, I can do that.
Thank you so much.
You're welcome. With Florida, we anticipate doing 312 units, 78 of which will be project-based voucher units, 154 tax credit units, 63 units slated for 80% of AMI, and then 17 market rate units. This is also going to include 1, 2, and 3 bedroom units. We conducted our community engagement meeting on September 17th, and right now we're in the process of following up with resident leaders. We have a meeting today to discuss when that next meeting will be, but it will likely happen in February. Between the time that we met and today, they are looking to see if they can add more senior housing to the project. So they've done a market study. We're going to speak with them about that today to see where they are on that and how we plan to move forward. Again, once we have that in place, they will submit for 4% tax credits, likely in the fall. So we expect that development to be completed by 2023. With Iris Phase 1, there are going to be a total number of 82 units in this project. Phase 1 will include 32 of those units. Right now, they are in the beginning phases of that project and starting the Section 106 process. We had our first meeting with the community on November 18th, and based on the feedback received from that community, the developers are going back and forth with SHPO as well as the City of New Orleans to update their design and do some possible modifications. They plan to do a formal response to the city by next week so that we can continue moving forward with that project as well. 2256 Barone, they submitted a tax credit application in December of last year. And so we expect them to receive a tax credit award come next month. Once they've done that, if it's received, they will begin moving to a closing and expect to start construction sometime in early fall of 2021 or by early 2022 with completion in 2023. Lower Ninth Ward scattered sites, Providence also submitted a tax credit application at the end of last year, so they are waiting to receive their award. Once we know if that award is received, they will also begin moving toward construction in the fall of roughly 2021. And finally, BW Cooper, we just procured a developer, so we are in the negotiation stages with that developer. It's going to be probably toward the end of the year that we will be looking toward submitting tax credit applications. And that's where we are with all of those projects to date.
Thank you, Gian. As you can see, we have a very robust program to expand affordable housing for the city of New Orleans. And these projects are in various stages of progression. They will take time. It's a lot of moving parts and a lot of complexity with it. But we are confident that we can get these projects moving forward and get these units in play by the estimated deadlines that are stated. But we also have a homeownership program that we have started. And if we can go to the next slide, we will show the projected number of homeownership units that we hope to, and I'm not sure if we can size up the slide so we can see the, I think that's the last column, the unit count. And so Gian, if you don't mind just giving us some details about the homeownership units and where we are with those.
Sure. Right now with Iris, with those 18 units, the developer is working to secure funding, and we're also negotiating the closing documents currently with the developer and finalizing the phasing of that project. On Lafitte on-site, we're expected to do 30 units there. 14 of them will be set aside for those at or below 120% of AMI, 4 for those at or below 80% of AMI, and 12 market rate units. We're working with the developer currently to update their construction numbers and also working with FEMA. So we expect to have some resolution on that within the next 60 to 90 days. The scattered sites for Mesa and Royal will not begin construction until we have completed the rental phase. So we will revisit that once we have completed the rental portion of the project. Two-Lane Canal, they are estimated to start in the summer of 2021. Right now, we're in the process of going to an active sale with them. We hope to have those units transferred over by next month. And finally, Home by Hand. We have 3 units, one on Villeray, the other on Domain, and a third on Bayou Road. They are currently in the permitting process. We transferred those lots over at the end of October, and we expect them to be able to start sometime in 2021 with completion by the end of the year.
Thank you, Gian. This is a small representation of all of the work that we do in Hanno. This presentation focuses on expanding affordable and home ownership opportunities, which is a part of the agency's goal to provide residents with economic opportunities so that they can become homeowners and contributing citizens. But this presentation shows you that Hanno's on the move. We are planning over 2,500 units to be placed in service over the next 3 years. This is a major initiative, but it's by far just one of the things that we do at the Housing Authority. We administer the housing programs where we serve over 22,000 families between the public housing program and the Section 8 program. We also have a preservation strategy because we realized that there was a significant amount of money that was invested in this community to a tune of $1.2 billion since Katrina. And so we have to engage in a major preservation strategy to ensure the longevity of the resources that were invested in this community and to ensure that there is a good affordable housing for the future. So let's go to the next slide. I just want to spend a little bit of time just talking about some of the other things that we have done amid COVID to assist our families and our investors with providing affordable housing to this community. Over the last, in September, over the last 6 months, we offered what is called a Landlord Incentive Program. We offer $500 to any landlord who would lease to one of our families on our waiting list. That program has since ended. We started it September 1st and ended it on December 31st, and we had over 170 landlords to participate in that program. For our voucher holders in the Section 8 program, we extended the deadline for them to search for units because we realized that it's very difficult to find a unit during a pandemic. With all of the safety measures that are in place and all of the fears in the community. We implemented a homeless initiative by reserving 225 housing choice vouchers for those families that were in the hotels during the pandemic. And we also reserved 250 vouchers for families that were displaced by Hurricanes Laura and Delta. This is we recognize that, the families that were affected in those areas were in need of housing, and we were willing to assist in that effort. And I believe we have a number of referrals that have been made so far. Next slide. That is the end of the presentation. I do want to say this, that we do have a housing choice voucher home ownership program that we have helped over 475 families to become homeowners using their Section 8 housing choice voucher. and we hope to expand and continue that program. We want to get the word out there because we think it is a severely underutilized program, and we want more people to feel comfortable that they can become homeowners even if they are a participant in our affordable housing programs. With that, I will take any questions you may have.
I was going to ask you to highlight the work that you all do with home ownership. Clearly in America, the quickest path to financial stability is home ownership. And there is this myth that affordable housing only somehow relates to rental units. Affordable housing is far more than just rental units. It's actually home ownership with working families that can afford to buy the houses that are here. So could you talk a little bit more about how you all facilitate that? And then the segue to that would be, what can we do to help you broaden the base? Clearly, I want to say thank you for the work that you all have done, and it's all commendable, but it's a lot more to be done. So what can we do to help you touch more families, to create more opportunities, to get more affordable units into the marketplace so that we can chip away at that 70,000 waiting list and get more people into housing?
Thank you so much, Councilman. The Section 8 home ownership program allows our families who are participating in that program to leverage their voucher to purchase a home. And the way it works is that the resources that we would spend on subsidizing their rent would go towards a mortgage. Now, that program is a very robust program, and it's a number of steps that the families would have to go through. They would have to go through financial counseling and home ownership training, and they would have to be qualified, and some of that may require them to repair their credits and so forth. But we've partnered with a number of banking institutions and housing counselors in the community to help those families get prepared to become homeowners. Usually it takes about 18 months to 2 years from a family to from the beginning to the end. But we feel as though that is a worthwhile effort to help them become economically independent and become contributing citizens and taxpayers, quite honestly, in this community. So that is a program that we, like I said, is very underutilized for, and we're trying to understand why people are fearful about participating in that program, because they still have the same safety nets that they have in the Section 8 program. So for instance, if they have a job and they lost their job, their mortgage contribution would be adjusted to where we would pay more of the mortgage and they would have a less of a contribution during the time of a loss of income, of earned income. So there's a safety net that's in the program. The program is about 15 years, so that mortgage will be covered as long as that family needs assistance for 15 years. And for disabled and elderly residents, it's a 30-year program. So it is a program with a lot of safety nets in place to ensure that that homeowner is successful in being a homeowner. Now, what can we all do? We can spread the word. I need people to spread the word about this program. We've, even during COVID last year, we did close on 12, we had 12 families to close in that program. We certainly would want to triple or have many, many more families to participate this year. And what I want landlords to know in our Section 8 program is not to be fearful. This is a way to have guaranteed income with the rental market and soon the home ownership market to be volatile. If you have a affordable housing tenant being assisted by this housing choice voucher or Section 8 program, you will get your rent every month. So those are some of the things that I want to highlight, and I'll ask Ms. Shelley Smith, who is our historian of this organization. She's a 30-year veteran of the Housing Authority, to speak to some of the other things that we could you all can help us with. Shelley?
Thank you, Ms. Hester. Thank you, Ms. Hester, and good morning, or actually we're in the afternoon period now, but good afternoon, everyone. We, in addition to our home ownership program, we have a family self-sufficiency program, which also assists our residents in getting on their feet and moving their families forward. We believe that program also provides our residents with an opportunity to set goals, goals beyond home ownership, goals that may relate to education, goals that may relate to jobs and different career opportunities for the residents. And that program also, in our view, gives our residents multiple opportunities to move forward and to set a path for themselves and their families. And so between that program and our home ownership program, we believe that it also allows our residents to move forward with respect to generational wealth for their families. So those are our two main programs that we're really proud of and that we are working with our residents to develop. We have entrepreneurship opportunities where we are working with our residents to put business plans in place when they are interested in entrepreneurship. And we also have a scholarship program which provides an opportunity for those residents who are interested in a college education, giving them an opportunity as well to become financially fit and to move forward on an educational path. So those are a number of the initiatives that we have in place. We continue to build on those. We appreciate the community partnerships that have been developed over the years, and we continue to build on those partnerships with community organizations as well. Thank you.
Well, Yvette, I want to tell you publicly that if you need help in spreading the word, I want to commit to that to you right now. I'm going to have Jarvis reach out to Leslie to connect the two of us together so that you can tell me how you can use me. I am holistically committed to doing everything that I can do. We've got to level the scale. We've got to make it possible for working families to be able to live here in this city. And that is 100% my intention. So Jarvis will call Leslie, we'll get something so that you and I can huddle up and you can tell me how best you can use me and whatever voice access or platform that I have to help spread the word and get folks involved in this process. I see my colleague, Councilmember Palmer.
Yes, I got a quick question. I'm a big fan of this program. I think it's much needed. As we all know, we lost probably 10 percentage points in the Black community for home ownership post-Katrina. And anything that we can do to consistently beef up those numbers is really important, again, to build wealth and equity in the city. So do you have a waiting list for this program as well? I know you said you've done 13 this year or 12, but is there like a pipeline? Is there a waiting list of folks that would like to take advantage of this?
I'll have Shelley to answer that question, if you can, Shelley, about the waiting list. I think it's, if you want to participate, you just sign up and we connect you with a counselor. I don't think that we have a standing waiting list at this time, but Shelley, if you don't mind.
That is correct, Ms. Hester.
So, but you don't keep track of how many people have called or contacted the office that have shown interest?
We do have that information. Yes, we do have a list of those individuals that have demonstrated some interest. But again, as those individuals demonstrate the interest, we work with them as they come to the table. And everybody, so we meet the residents where they are, if you will. So if in fact, they sign up and indicate, that they would like to have the training, then we hook them up with the respective providers that, begin training, begin looking at their credit ratings, et cetera.
So could we get, just to get an idea of how many people are interested in this program in homeownership, a list of everyone that's contacted you? Not names, obviously, but numbers of people that have expressed interest. And so when they contact your office, you then send them to somebody who does homeownership training, not within Hanno, but like separate organizations, or is it all done within Hanno?
Actually, most of the training is done through third parties that we partner with.
Great.
And so we can provide you with a list of the partners and also a list of individuals that have expressed interest that are currently working with those partners.
That would be great, because what the method to my madness here is that I would really love for us to get a number that we need of home ownership, of people that we can get to become home ownerships that bring us up to the national standard for cities in terms of the people that own property, that own their own homes, right? And then we know that, okay, we have a goal of 500, 1,000, 2,000 folks that we want to really try to incentivize to purchase a home in New Orleans, right? And so I would love to get that number, but I would also then love to know how many people within Hanno have shown interest, right? And whether or not, because I think we also need to make sure that we have enough third-party providers that that are doing the training, which obviously is the pathway for success for any program, right?
Right.
And then how many people staff within Hanno are staffing this program?
Okay. So we will provide those statistics to you, Councilmember Palmer, and get the information compiled, especially as relates to providers as well.
Yeah, that would be great.
Yes.
I'd really appreciate it. Thank you so much.
You're welcome.
And so is there one person within Hanno or two people in Hanno that are specifically the contact people for this program?
Yes, we do have a number of staff members that they provide assistance for both our home ownership and our family self-sufficiency programs. Right now, we have 3 full-time staff members devoted to those programs.
Great. Thank you so much.
You're welcome.
Thank you, Councilmember.
Any other colleagues? Cindy?
Yeah, thank you, Jay. Ms. Hessler, can you talk about, because you mentioned about the landlord program, how, you know, they can sign up and they'll get paid, but can you talk about how landlord are selected in reference to the quality of housing they're providing for residents? What is the standard Hanno requirement for quality of living?
So in order to put your unit on our program, obviously you can list it and our tenants have the option of selecting and leasing with you. But in order for your program, your property to get on our program, it would have to pass what is called a high quality standards inspection. And that inspection is a HUD protocol that all housing authorities are required to utilize. So that's the standard. And it looks at everything from the interior to some exterior items of the property. But those are codified within that HUD protocol that all housing authorities must use before property is placed on the Section 8 program.
And do they conduct an annual review of the property?
Yes, there's an initial inspection for the property to come on the program, and then there is an annual inspection that is required for the program. Some units are selection for quality control inspections, and there may be special inspections that may be conducted during the year as well. Some of them are complaint inspections from both the tenant or some other outside persons or entities.
So that was my other question. Is there a way that if a tenant can contact Hanno if they are living in a property that is funded by Hanno and that is not in good condition? So there is a number that tenants can actually call.
Yes, they can call their case manager, who they get their interim or annual recertifications performed with, and they will facilitate scheduling a special inspection for that unit. And we do use a third party provider to perform our inspections, and we have used them since October of 2019. So they will contact their case manager, and then their case manager will facilitate getting that inspection scheduled.
So how soon is an inspection? The inspection is done when the
So is the question how soon after they contact? Usually within 2 weeks. If it's an emergency item, within 24 hours. If it's a routine item, within 2 weeks.
Are you able to share with my office, and I don't know if this is a federal violation or not, but just wanted to know an idea of where all of the piano property, because you mentioned earlier at the beginning of your presentation that we have over 5,000 vouchers, and I'm assuming that is in residential area in District E. Can you share with me a map or where those houses or those rental properties are at?
Yeah, I'm sure I can share with you a map. I'm not sure about the individual addresses. I'll have to check with our counsel on that.
Yeah, and then would love to kind of get an idea of number of complaints in my district in reference to tenant calling Hanno and complaining about quality of life, particularly at the place where they're at, and how the response has been.
Okay.
If you're able to share with me those information.
Yes.
All right. Thank you very much, ma'am.
You're welcome.
Thank you, Cindy. Colleagues, any other questions or comments? Okay, do we have any public comments? None? Okay. All right. Well then, thank you, Ms. Hester and all of your staff, and we will be circling back. I definitely, again, want to reemphasize that I want to work with you on getting the information disseminated to as many people possible on that home ownership program. I've already told Jarvis while we're sitting here to call Leslie to get something set so you and I can sit and chat to figure out how best you can use me and whatever else I can bring to the table to get that disseminated. So with that, thank you all.
Thank you.
Thank you.
We'll move on with the agenda. Next up is an update on the cemeteries. The presenter will be Martha Grissett. Martha is going to be on the phone. She will not have a visual connection, but she's on the telephone. So Martha, are you here?
I am. Good afternoon, council members.
Hi there.
I did prepare some slides. I guess we'll wait for those to pop up. There we go. Okay. I appreciate y'all having me here today. You can skip to the next slide. Just a brief overview of the cemeteries in which council districts they're in. We have St. Mary's Cemetery and Carrollton Cemetery and Holt Cemetery, all in Council District A. St. Mary and Carrollton are a couple blocks apart from each other. Council District B has Valence Cemetery, Lafayette number 1 and number 2. And Council District E has Rest Haven, which is used primarily by the coroner for unclaimed bodies. Next slide, please. So recent changes to cemeteries, despite delays due to the cyber attack and COVID-19, we've managed to eke out some improvements to our cemeteries division as a whole. We hired an in-house cemetery crew for better, more directed groundskeeping. This is helping to reduce on-chemical use for weed abatement. And the guys we hired were onboarded initially through the reentry program to help us set up Mardi Gras viewing stands, temporary workers. But they were standouts, and we were excited to make them permanent employees. That was in Mardi Gras 2020. We've started rebuilding the cemeteries division, which was down to only one very hardworking employee, Kawanda Baxter. Emily Ford, probably the most qualified cemetery personnel that we could possibly hire for a superintendent, we joined our team, and she's been working to restructure the ancient interment files, manage the ground crew, and make sure that burials are done respectfully and appropriately. It's noteworthy that since COVID-19, the number of burials has grown exponentially. And Ms. Ford and Ms. Baxter really deserve a shout out for the amount of work that they have had to do during this pandemic. Not to mention that Emily has been part of our working team with the death care community throughout COVID, managing how to do burials during this time and restrict the number of people that actually come to a funeral. It's been very difficult. We've done some improved legislation. In November, we updated the cemetery ordinances, which hadn't been changed since 1956. There are references to things that don't exist anymore, like sextons and don't bring your phonograph to the cemetery. And we created a revolving fund for city cemeteries, which is required by state law, but we had never done it. And we've created a better structure for the management of the cemeteries. Capital improvements have occurred. In Lafayette number 1, we renovated the Sexton Cottage, which actually had been updated a few years back, but got completely eaten out by termites. So we had to put a new roof and siding on it. And we also added a restroom to the facility. We've repaired water lines in the roadway. And Ms. Ford's team has closed almost all the open tombs. We're waiting on bond funding to complete whatever other capital improvements we have to do to the cemeteries. Hurricane Zeta caused some damage primarily to Holt. The other ones, cemeteries just had branches down, that was quickly remedied. But there was a large water oak and smaller trees that were removed from Holt Cemetery. This required coordination with the Cemeteries Division, the city archaeologist, the State Cemeteries Board through the Louisiana Attorney General's office, and of course, Parks and Parkways, who did primarily all the work. It's a very delicate cemetery. And anytime we do anything in there, we have to be very careful. So lastly, Ms. Ford has received a grant for the city to document the history of Holt Cemetery. They're doing family interviews of the deceased, oral histories, and photography research. And it's going to create an oral history of that cemetery. It's a very exciting project. Next slide, please. So obviously, we've had a bit of a snafu with what with first a cyber attack and COVID, and now we've got funding issues, but we're still moving on with new and exciting activities. We are putting out an invitation to bid for interment and burial services. Currently, if you have to bury someone in Holt, you have to hire an outside grave digger to come and do the burial. We've had a lot of issues with the quality of that service and the depth of the graves. Like I said, it's a very delicate cemetery. By putting out the ITB with the revolving fund that you all helped to put through ordinance, we can actually hire a grave digger to do things to the quality standards that we require. And we can pay them through that fund so that it doesn't just get lost in the general fund and we're looking for money to pay. So further capital improvements are expected. The bond sale, which should be occurring in April, will have $1 million dedicated to cemeteries. That's going to allow us to complete the Lafayette number 1 walkways, add automated gates to all of the cemeteries, and hopefully find us, to build a new cemetery because we do need to replace Holt. Lastly, we expect to have security for Lafayette number 1 when it's reopened. We need better control of tour groups and other visitors so that there are less people at any given time within the cemetery. I think everybody's aware that it's been a problem in the past. I was looking at all of the emails that Councilmember Banks' office has received about this meeting, and primarily they're from tour guides that, are upset that the cemetery is not open, but they also understand the issues that we have got to take care of prior to reopening. And that's about where I'm at.
Martha, thank you. I wanted to highlight where we are with this, because we have gotten calls from folks that have said that there have not been any activities taking place in the cemeteries, specifically Lafayette number 1, since we closed it to the tours. And I wanted you to come on and just talk about exactly where we are, because one of the things that I think that we should not lose sight of is that the cemetery is a cemetery, and it was a cemetery before it got to be a tourist attraction. So while it is a part of New Orleans culture, we have a very unique way of burying people here. Those cemeteries are still sacred places, and the priority use for them is for those families to pay respects to their deceased loved ones. So there's a balance somewhere in between having the families have the access and the privacy and the reverence that they deserve, and having it accessible for the folks that want to just come and view it. So that's what I specifically asked you to come about to clarify. And I appreciate you doing that. I see Councilmember Palmer. Do you have some comments?
Yes, I do. I just want to thank her whole staff and team. You know, my family's buried in Lafayette number 1, and y'all have been very responsive. And I know I've talked to other families as well in terms of opening up the cemetery to allow people to visit their family tombs. So I just want to thank you. I know that's an added burden during this period of closure, but I just want to thank you all for being very thoughtful to all the families out there that still have access to it. And then I also just want to comment that I agree with Councilmember Banks wholeheartedly. I hope that when it is reopened, that there is a better control of the tour guides in terms of how they need to be respectful of that space and of that place for people that visit, as well as for the fact that it should be a respectful place. And I know that Councilmember Banks' office has been working very closely with y'all on what that looks like. I also know that other cities like Savannah have done a very good job in managing their cemeteries. And I just want to thank y'all again for the work that you've done on this.
Thank you.
And Martha, if you could, do you have a timeline as to when the repairs will be completed to Lafayette 1?
Well, there's 2 factors at play here with the repairs. I agree with the complaint that there haven't been a lot of repairs recently, but we are in a time of COVID, and I think it would be unwise to throw open the gates to a public facility where you can't possibly socially distance on narrow pathways. As it is, you know, if you come to City Hall, you cannot just walk through the door and go to the office you need to go to. You have to have an escort. We only allow 4 or less people on an elevator. And this is sort of the same situation. Granted, you're outside, but it's a very narrow, small space. And if you're not going to be climbing up on somebody's private property, which we know has happened in the past. So I think once we get through to the point with COVID-19 where it's safer for people to congregate, then we could probably get to the place where we can reopen. And hopefully that will be well timed with renovating the walkways. And I couldn't agree with Councilmember Palmer more that we absolutely have to have some kind of controls in place. I noticed that a lot of the messages you received from tour guides, they were concerned obviously with the tourism itself, but they also acknowledged that so many people were abusing the privilege. It's not a right to walk in the cemetery, it's a privilege. And we need people to respect the bereaved and the private property that exists within the cemetery. And if when we reopen, and we will, and we'll do it when it's safe, but we will do it with controls in place to make sure that people behave themselves and that it's not too crowded.
Thank you, Martha. And I just want to reemphasize that the goal is to get to a sweet spot, to get to a median where we can have the access for the people that want to come and look at this very unique aspect of New Orleans life, but also be done in context with making sure that the reverends and the families will have the ability to mourn their ancestors in a proper way. So that is the goal that we're working towards. And there is nothing nefariously being hidden about it. We're being very open about it, that we're getting to that. And as long as COVID is in place, it is impacting the way that we do business in a lot of ways. But that is the ultimate goal, to get to that. I think we've got public comment. I'm sorry, Kristen, were you done? Cindy, anybody else? Okay, with that, I think we've got.
Good, thank you, Jay.
Okay, public comment, please.
Yes, sir. All right, y'all can hear me? All right, there are 10 public comments. First one is from Joshua Johnson.
Jenna, we can barely hear you.
Oh, let's see. The first public comment is from Joshua Johnston, representing himself. He says, thanks to the committee, to the Cemeteries office, and especially Councilmember Banks and his office for helping get answers on this issue. We who host historic tours in the Garden District do so because we love sharing a deeper connection to the history, culture, and architecture of the city with visitors. Many have invested in businesses, some thousands in operating licenses, insurance, bond, on top of hiring employees and advertising. My family and newborn son were economically devastated by the sudden cemetery closure. Our childcare had to quit to seek other work, so urgent was the need for repairs that this was barely announced. And yet, almost a year and a half later, repairs have not begun. No accountability, no timeline. Closing public property requires a public hearing and allowing public comment from stakeholders, so you can hear all stakeholders and consider less drastic solutions. The process was skirted by this dangling repairs loophole. We saw the disturbing culture created in the previous property management department when it became unaccountable to the public. It was downright dangerous. And now we're seeing this limbo 1 year later play out exactly as predicted. It's been a parade of shifting and unsustainable claims from the city on this issue, like safety issues, where there's no record of incidents or study done. The city says they expect 3,000 visitors per day to Lafayette number 1. And yet, even this far out, none of our representatives has even thought to calculate the enormous economic impact on this indefinite closure of uptown businesses. Now they even claim there would be no reduction in that 3,000 due to COVID, so they can't reopen. We're not being told anything that's even realistic on this issue on why this decision was made. Question. Councilmember Palmer, did you play any role in encouraging the city to close Lafayette number 1 or hire the director of cemeteries in her present position? Second comment is from David Hedges, representing NOLA Tour Guy, LLC. Hello, I have offered visitors to our city historic walking tours since 2012. I've always loved history. I studied that in college, and by starting NOLA Tour Guy, LLC, I've been able to turn my passion into a career. I have found that many visitors would like to learn something about our unique history and culture, and most visitors don't want to cause any harm or do anything disrespectful. But visitors need guidance, and there has been no guidance from the city. Lafayette Cemetery number 1 is an historic gem, a unique relic from our past that, to be honest, the city of New Orleans has done little to protect or preserve. We have offered cemetery tours since 2013, and once the New Orleans Catholic Cemeteries decided to close St. Louis number 1 to the general public, requiring a licensed tour guide to visit unless you had family interned, I saw a huge uptick in disrespectful visitors. In my experience, these people were not on tours, and many were there because the cemetery had been featured in popular movies and TV shows, which the city has allowed and benefited from. I also did start to see tour guides outside the cemetery soliciting visitors and some selling Ouija boards. This is disrespectful for our family interned in the cemetery. I could not imagine going to visit my mother's gravesite and have to push past crowds of disrespectful tourists just to pay my respects. That said, there are plenty of ways to balance the needs of families with the wants of tourists. I would strongly recommend that the City New Orleans Department of Property Management reach out to the New Orleans Catholic Cemeteries. They have done an excellent job preserving and protecting St. Louis number 1 for future generations and allowing visitors in a respectful manner. What they have done could be used as a template for Lafayette Cemetery number 1. Next comment from Shelley Landrew, representing the Garden District Association. The Garden District Association has invested thousands of dollars and many, many volunteer hours on landscaping in front of the cemetery along Washington Avenue. When we began our project, we had the full support and cooperation with Parkways, Public Works, and the Mayor's Office. We have also organized groups to clean up the cemetery at various times. Because the cemetery is in the center of our neighborhood and a destination for many tourists, we have asked several times to be kept in the loop on renovations and works being conducted by the city at Lafayette No. 1. Information coming from the city has been almost naught, and inquiries are often met with resistance when before the communication was open, transparent, and cooperative. We have offered to come to the table to discuss some sort of public-private partnership and help find ways to fund the regular maintenance of the cemetery. We respectfully ask again to be allowed to participate in the discussions surrounding this large destination point and landmark that sits in the center of our neighborhood. Next comment is from Elizabeth Bellino, representing Lucky Bean Tours. Dear CDC members, thank you for hearing comments regarding Lafayette No. 1. I'm a resident of New Orleans, a tour guide, and the owner of Lucky Bean Tours, a small walking tour company. The Garden District, including Lafayette Cemetery No. 1, is one of the areas that visitors are most interested in seeing. The interest in seeing the nearly 200-year-old cemetery led to some damage of this irreplaceable space. On my tours, I admittedly witnessed the decline in the condition of several tombs and some irresponsible behavior from visitors and tour guides. For the most part, however, I witnessed people who were moved by and interested in our beautiful monuments to our loved ones and our unique funerary practices. I understand why the city closed the cemetery, but I also know that those tombs were not meant to be locked away and unseen. The people who built those crypts and tombs and chose the symbols, statues, and words to honor their lost loved ones intended for them to be seen. When we guide people through the aisles, we are telling the stories of the people who rest in the tombs and the story of New Orleans itself. I think that if the city were to create a model similar to the one created by the Archdiocese for St. Louis No. 1, the interests of all parties with a stake in this issue could be satisfied. The families could have full access to the cemetery with time set aside for only family members, and the tour companies could have contracts with the city in which the rules of conduct are strictly laid out. The tour companies in turn would have to provide the proof of liability insurance and pay the city a set amount for each guest they bring in. In addition, the Archdiocese allowed one company per day to take walk-up guests into the cemetery for an agreed-upon fee. The money raised from this plan could then finance repairs to the cemetery and the salary of a gatekeeper. I would go one step further than the Archdiocese and suggest a required training for tour companies on tomb preservation and proper behavior in the cemetery. Also, I think that tour guides should not be allowed to meet their guests anywhere on the 1400 block of Washington. The congestion on that block led to an atmosphere that did not seem respectful and must have been disheartening for families and friends wishing to pay respects to their loved ones. Thank you again for the opportunity to be heard. I'll be watching with interest as you work towards an arrangement that will benefit all parties involved. Next comments from Mary Fanning Horist, representing herself and her family. As a family member of our family coping in Lafayette Cemetery No. 1, I'm disappointed that the city has done little to make repairs. However, I do not want tour guides to return. As it is, even under lock and key, they continue to hover like flies around the perimeter of the cemetery, and I've tried to convince family members and others to allow them in. No! Exclamation points. They are part of the reason that we, as owners, could not get to our properties. This is hallowed ground, and it needs to be treated as such. Whatever you do, do not allow intrusion into our holy ground of our ancestors, where they contributed directly or by neglect to the deterioration of our properties. The last time I was there, I found a bone left on top of my coping. So did they just up and drop it or what? We must have security and no more desecration. Emily has done a fabulous job working with owners so that we can care for our properties and our ancestors' remains. Please do not let it open again. Please make the repairs to the roadways and alleyways so we can safely get to our copings and tombs. Thank you. Next comments from Christine Miller, representing Two Chicks Walking Tours. As a resident, as well as a licensed tour guide and tour operator, the continued loss of access to the grounds of Lafayette Cemetery represents a separation from a sacred space that allows me to connect to our history and culture in a particular way. Cemeteries the world over are visited and reflect elements of a society in a truly unique way. Tours are commonplace in many places. It's my hope that the future of Lafayette Cemetery No. 1 will once again allow for people to explore and reflect on who we are as a people. The sudden closure was a costly blow to both my business, both financially and administratively. The number of calls, texts, emails, and all the necessary steps to address the change in access were substantial and indeed unfortunate. My hope for the future includes greater communication for the small business community. My business practice limited attendance to 14 people pre-pandemic, and guides attire was always professional. These were areas of concern previously raised. While I know there were several bad actors cited, there are also numerous responsible tour operators. Perhaps guidelines in the future can outline the desired parameters with the ability for the city to enforce or provide oversight on an ongoing basis. Thank you for your opportunity to present on the topic. Next comment is from Cindy Dax, not representing anybody, and there's also just a blank space in the public comment, but there was an entry. Next comment is from Alyssa Pandora Scott, representing Spectral City. Hello, everyone. I'm a tour guide and operator in the French Quarter and Garden District, and I'm thrilled that y'all have taken the time to discuss this today. This issue has been close to my heart and on my mind for a while now. The cemetery is one of my favorite places to be in the city and something that guests to my tours always love. Guests are reliably extremely disappointed to see the cemetery closed and see that nothing is happening to get it to an open status again. There are many tour guides and shops who depend on being able to give tours there to support themselves. Even back when Lafayette Cemetery was open, people were distanced. There's no way it would be bringing in the same amount of money during COVID as pre-COVID. We can't really live with the additional years of delay because everyone decided to ignore this and do minimal things like adding security cameras, seemingly to gain more time. We can do really great things at the cemetery, and there's plenty of potential leadership who cares and would love to help for free even. Let's pay attention and be mindful in all areas of our lives and in our dealings with our great city. All right, this comment is from Rob Florence. Hello, Community Development Committee meeting. My name is Rob Florence. I am a tour guide and tour operator, as well as a preservationist, public author, and documentarian, and founder of Tour Professionals of Greater New Orleans. I am writing to ask that you reopen Lafayette Cemetery number 1. Yes, there have been problems, and our organization, TPGNO, has been working closely with the city to solve these problems. It does not seem like a productive solution to simply close the cemetery off to locals and visitors alike. We cannot change the fact that for more than 200 years, our cemeteries have been a source of curiosity, aesthetic pleasure, and genealogical data to people around the world. One of the big problems had been the illegal solicitation at Lafayette Cemetery number 1 gate by tour guides, some licensed and some unlicensed. Monday, May 21st, 2019, City Hall hosted a meeting with TPGNO. Representing the city, the meeting was attended by Wesley Pfeiffer, Sonia Armstrong, Jenna Burke, Jennifer Cecil, and Matthew Schoenberger. Representing the Garden District was Shelley Landrew, and representing the French Quarter citizens was Susan Guillot. Representing TPGNO were Roby Robichaud and myself. The city informed us that they were working on long-term solutions, and we concluded the meeting with some short-term solutions. Placement of a sign at the cemetery entrance warning visitors only to take tours with legally licensed guides. A suggestion was made that this sign point out that solicitation is illegal, which could discourage solicitors from soliciting right underneath the sign. Jennifer Cecil from the Department of Safety and Permits informed us that we can report illegal activity to their website to create a record of it. A more permanent solution may be to follow the Catholic cemetery model and charge tour guides a fee to bring visitors inside the cemetery. This should solve many issues. Very urgently, it would raise revenue to fund the city's maintenance of the cemetery. It would eliminate illegal solicitation at the front gate and ensure that only licensed insured tour guides were touring the cemetery. It would enable the city to control who can tour inside the cemetery and to ban any guide who violates the city's requirements. It would also reduce the number of guides touring the cemetery. The situation poses problems for which there might not be solutions which thoroughly satisfy everyone involved, but having these magnificent above-ground cemeteries in New Orleans is a nice problem to have. Let's resume dialogue on this subject. The city, the tomb owners, the tour companies, and the neighborhood residents. Let's put our heads together and devise a solution which is more constructive than closing the cemetery for 18 months and counting. I can assure you that as we continue to implore people from around the world to visit New Orleans, thousands of them are profoundly disappointed to discover they cannot access the cemeteries which the city proudly boasts. Those of us in the tour guide business want the same things which is the city, the tomb owners, and residents want. A civilized situation in and around our cemeteries, a responsible interpretation of these historic sites, and a revenue source to maintain these fragile and endangered landmarks. Please stay in contact if you would like to work collectively on this issue. Thank you for your consideration. And the last comment is from Joshua Johnston, again, representing himself. He made a note that the agenda to this meeting was altered within 24 hours in violation of public meetings law. This is the second comment I'm making, but only because somebody must point out this violation. I'm not entirely aware what the change is at this late point, but that is not legal or acceptable. A quick note, if anyone from the council office, sorry, that concludes the public comment. And a quick note is that the agenda site just automatically updated when the presentations were included, and that all legal guidelines were followed and notice requirements. Thank you.
Hey, Jenna, thank you. That concludes the presentation on the cemeteries. We'll be moving on with the agenda. Next up is the community sailing program, and its executive director, Mr. Jacob Raymond. And Jacob, good morning. I'm sorry, afternoon. And I appreciate you joining us. This is a very exciting new opportunity for our citizens, and I'm anxious for you to share it so folks can know this is available.
Yeah, thank you for having me. I'm very honored and humbled. I believe I have a slideshow presentation. My name is Jacob Raymond. I'm the Executive Director of Community Sailing New Orleans. We are a nonprofit organization that is dedicated to eliminating the economic and physical barriers to sailing for all in the greater New Orleans area. I entered this role on March 1st of 2020, just in time for a pandemic and a record-setting hurricane season. I'm coming from Norfolk, Virginia, where I worked as a program manager for Sail Nauticus, and prior to that, I was in Charleston, South Carolina, where I worked for the College of Charleston Sailing Department, overseeing their outreach efforts. I've had the pleasure of working with programs such as Special Olympics Sailing and Warrior Sailing, a program for wounded, ill, and sick veterans. The past 11 years, I have dedicated my life to making the waterfront and sailing affordable, accessible, and approachable for everyone. Next slide. Community Sailing New Orleans' mission is to positively impact lives by providing accessible, educational, and recreational opportunities on Lake Pontchartrain for people of all ages, backgrounds, and abilities. While community sailing centers are new to New Orleans, there are over 400 similar organizations in the nation dating back as far as 1946 that share our very mission. Community Sailing New Orleans was founded by our board president, John Maynard, a gentleman who I've had the great privilege of working with for the past year. Next slide. John recognized the injustice of having this wonderful resource of sailing on Lake Pontchartrain only accessible to a few. Therefore, John spent years assembling an amazing team of board of directors who all worked together in planning, fundraising, overseeing construction of a Lakefront Campus, building partnerships with local nonprofits, and gathered together a fleet of 49 boats and paddleboards. All of this hard work was driven by the ideal of an inclusive waterfront that affords everyone the same opportunity. Our program focuses on enhancing the greater New Orleans community by utilizing the sport of sailing as a platform to develop independence and self-confidence, improve communication, foster teamwork, and acquire deep respect for the marine environment. The Sailing Center is a place that provides a safe and supportive atmosphere that nurtures all these qualities and encourages a sense of community where everyone feels welcome. Next slide, please. The Lakefront Campus is over a half acre, which is located at the newly built municipal harbor. There is a 12,368 square foot bulkhead built to create space for offices, work areas, and small boat fleet storage. On site, there's a floating dock, a hoist to launch and retrieve boats, and 8 slips. The forefront of designing the facility was to ensure it was accessible to everyone. All ramps are ADA compliant, the finger piers were widened for wheelchair accessibility, and transfer equipment was built into the docks. Community Sailing has 49 boats to include a fleet of 7 Independence 20s that were specially designed for sailors with disabilities, ensuring there was a boat for everybody. Next slide, please. Community Sailing New Orleans has programs for everyone, but our focus is on underserved youth, people of all ages with disabilities, veterans, and on providing women and girls an equal footing in the sport of sailing. We deeply value safety, so many of our endeavors have been postponed due to the pandemic. We operated as much programming as possible by strictly adhering to all city, state, and CDC guidelines to ensure we kept our participants safe and healthy. We were able to pilot a youth program, provide open access to sailing for families, and collaborate with our partner groups. We are optimistically planning on spring and summer programming, but keep in mind that we may have to pivot and adapt. A variety of programs will be offered to children who have not yet been exposed to boating on the lake. Students will be able to participate in youth courses on the water that promote life skills, teach STEM education, maritime career development, and help guide them to become positive role models in the community. STEM and sailing programs will offer all students an equal platform for learning through an active participation in science and sailing curriculum. Students develop their confidence and appreciation of the natural world, improve their scientific and mathematical understanding of sailing while increasing their comfort with the local aquatic environment. Critical thinking skills are enhanced as students work through real-world challenges. Our Girls Rock the Boat programs are all female that will provide young women an equal footing of the sport of sailing. Sailing clinics will help build confidence in sailing skills while cultivating positive female role models in the sport. Our Crew to Captain program began last September with a small group of 9th and 10th grade students from Son of a Saint. In Louisiana, 1 out of every 5 jobs is related to the maritime industry. This 3-year maritime career development program is designed to have students learn skills on the water, teach professional development, and introduce potential careers through guest speakers, all the while encouraging high school completion. When students complete the course, Community Sailing New Orleans will offer them a part-time work as a sailing instructor if they pursue vocational training or higher education locally. These youth programs are much more than recreational courses. They are designed to teach soft and technical skills why children build better lives for themselves. Next slide. Another cornerstone of our program is adaptive sailing. Adaptive sailing will provide accessible opportunities to individuals of all abilities, with emphasis on creating an inclusive environment where people with physical or developmental disabilities and their families feel welcome. The entire sailing center and fleet have been purposely designed and actively modified so that we may accommodate a wide range of disabilities. Community sailing will create opportunities to help all youth and adults overcome adversity through therapeutic sailing. While learning how to sail is fun and enjoyable, participants will also experience increased self-confidence, the camaraderie of teamwork, and improved leadership skills. Also, strong partnerships are being formed with veteran groups in the area, and Community Sailing looks forward to providing a program for veterans. Sailing opportunities will provide a therapeutic outlet and a pathway of reintegration into the community for men and women who have served. The Sailing Center is fully open to the public. There is no membership. Our connection to underserved youth, people with disabilities, veterans, and women and girl constituencies that we serve is accomplished primarily through our nonprofit partners who share the same values of diversity, equity, and inclusion. We value collaboration, and working with those partners allows for connecting with a broad range within our community and addressing the issues of swimming, transportation, and parental approval. Thank you again, council members, for allowing me to speak today. I hope everyone takes me up on an invitation to come visit me by the lake and take a tour of the fleet and facility. After all, it is your lake, your boats, your community sailing center. Next slide. I'd be happy to answer any questions.
Jacob, thank you. Let me first of all, again, commend you, and I would also encourage all of my colleagues and all of the citizens listening to please go out to the lakefront and actually go and look at this. This is a phenomenal project in our city that has got all winds on it. So this one doesn't have a downside. And too often we do have things that have a backside to it, but this one is good all the way around. Jacob, clarify for me, what is the cost for a child to participate in this program?
We have different price ranges, those that are open to the general public. For our nonprofit groups, we offer a variety of different programs that range from $8 to $32. If the nonprofit organizations are not in a position where they can pay for their youth to come here, we also have small funds set aside for scholarship and subsidies for the course. So there's a variety of different price ranges, but all making sure it's affordable to the general public.
And I specifically asked that question because I'm hoping that some of the folks out there listening will come out and take a look at it. And if you can help, it's a nominal fee that could positively impact a child's life forever. And there is an old saying that goes, if you don't give these children something constructive to do, there's a possibility that they will find something destructive to do.
I don't
And
have
anything to do to funnel our children in the positive directions, I am vehemently in support of. Now, sailing is truly, man, not in my wheelhouse. That's something that that the only sailing I do is on the ferry. So with that, I'm excited about this, and I'm excited that we can expose our children to something that folks of my generation hadn't been exposed to. Now, I've lived in New Orleans my whole life, and I probably went out to the municipal yacht harbor maybe twice, and that's been since I've been on the city council. So most of our residents don't even know it's there, and most of our residents who look like me certainly don't know that it's there. So this is something that I think we ought to expand and let folks know that it's there. We live in a community surrounded by water, and whatever we can do to increase water safety is also a benefit. When you talk about the economics of this, one of the best paying careers probably anywhere on the planet is river pilot. And exposing children to maritime could open a whole new horizon that they had never even thought of. So I'm extremely excited about this, and looking forward to doing all that we can do to broaden the scope and the horizon so that more people will know. And I want to ask, again, any of those businesses out there that may need to get a tax deduction, please come take a look at this, because you can definitely impact our children in a positive way by helping to support them in positive activities. And this is one that is really a good one. I see Councilmember Palmer, if you have a comment, ma'am.
No, I just want to thank you, Mr. Raymond. This is very exciting. I agree with everything Councilmember Banks says, but, I also just want to highlight that, this is also a great entry for college applications and for scholarships. Often people get so wrapped up in sports in the traditional sense that they're forgetting that there's a whole nother world out there. And I think this could be it. I also do not sail, but I think it's a great thing for people to also kind of take ownership of where they live. And a lot of kids have not been out there and are probably intimidated by it. And this is a way for them to take control of it, as well as having ownership of where they live and our unique culture and our unique geography. So I just want to thank you for that. And I would also hope that you've made this presentation to the Port of New Orleans. There are a lot of businesses at the port, and a lot of that bring in a lot of money. And I would think that they would do very well in underwriting you, because they'll see the connection that Councilmember Banks brought up. So thank you.
Thank you, Council Member.
And Jacob, we also want to try to be the conduit to connect you with Larry Barbino of Landlord and with the principals of the various schools and the charter operators. We need to have this opportunity. All of the children who are in this parish ought to know that this exists and have the ability to take advantage of it. Do we have any public comment? None? Okay. Any other colleagues? All right, seeing none. Jacob, thank you so much.
Thank you, Council Members.
All right, and moving on with the agenda. Next up is Nicole Hyman, who is the Director of Community Assets in the Office of Business and External Services relative to a foreclosure registry. Good afternoon, ma'am, and welcome.
I can hear you now.
It's great.
Great. Thank you very much for this opportunity today to be here with you and for affording me the opportunity to present on the Mortgage Foreclosure Registry Ordinance. The Mortgage Foreclosure Registry Ordinance is a tool at its heart to combat blight in the face of mortgage foreclosures. Unfortunately, COVID-19 has caused financial uncertainty, and the city may see an uptake of mortgage foreclosures as a result. The foreclosure registry presented to you today is modeled after national best practices in place since the mortgage foreclosure crisis of 2008. Currently, there are hundreds of municipalities across the country that are implementing similar foreclosure registries. And the national lending institutions have accepted these registries as a cost of doing business. The foreclosure registry will hold lending institutions responsible for property maintenance during the foreclosure process. It applies to both residential and commercial mortgages and properties. Next slide, please. When a property is placed in foreclosure, the lending institution will be required to register the property with the city, pay a $300 biannual registration fee, appoint a property manager regardless of occupancy at the time, and maintain vacant properties or properties that become vacant during the foreclosure process. Slide, please. The foreclosure registry will be operated and implemented by a third-party contractor who will contact the national lending institutions on behalf of the city and inform them of their registration requirements. The vendor will register properties on behalf of the city and collect fees and remit them to the city on a monthly basis. Slide, please. The vendor will also collect property management information for each property that it registers, and it will maintain a web-based database that will be given access to the city of New Orleans so that we can coordinate data sharing, and they will also be responsible for providing monthly registration data and financial accountability. The third party will be paid out of the registration fees it collects for each registered property. And therefore, the city will not be expected to use funds to implement the registry other than minimal staffing costs to implement the third-party contract. That concludes my presentation, and I'm happy to answer your questions.
Councilmember Palmer.
Thank you, Councilmember Banks. Well, this makes me excited that we're doing this. I want to thank you, Ms. Hyman, for bringing this to us and the administration. I have a request, if it's possible. Can we have them post something on the outside of the house with their name and the phone number of a real person, not a, I don't know, not an answering machine. I guess that's kind of archaic, but if you know what I'm getting at here.
I do, and the ordinance actually calls for the property manager to post their contact information on every registered property. So that's already built into the ordinance, and it will be required by the property maintenance
Great. I just want to
contractor.
make sure how large it is. If we can, is that spelled out, the size of the sign?
I believe so, but I will definitely get back to you with that.
And then also the business hours that a person can be reached with that phone number.
Yes, ma'am.
So it's not just an answering service somewhere. It has, I really want to be very clear because, we spend so much administrative time in all of our council offices, and I'm sure you do, Nicole, and the people at the city and 311 with, folks calling us to complain. And I really want the property managers to get these complaints as well, because I just think we should all share in that love.
Absolutely.
All right. Thank you.
Thank you.
Do we have public? I'm sorry. Okay, come on.
Yeah, Nicole, when you spoke of the third party, are we looking at a third party outside of New Orleans to do this, or are we working with a third party within New Orleans that has the skills and the ability to help us administer this program?
We've released an RFP, and the responses to the RFP are due in 2 weeks. We released the RFP last Friday. And so we'll have to see who responds to that RFP. I will tell you that because there are hundreds of these that are being implemented across the country, there are several national organizations with the contacts necessary to implement this type of program. But until we get responses to the RFP, we won't know the answer to the vendor.
So are their fee of service is going to be based on the number of foreclosure property we have in the city of New Orleans? How are we looking to pay them?
Yes, ma'am. The structure is generally that the third-party administrator is paid out of the fee collected on behalf of the city. As part of responding to the RFP, the vendor will tell us how much of that $300 biannual registration fee they will keep as their fee and how much will be remitted to the city, but they will be only paid for properties that they register.
Are we also putting in the contract when they are not in compliance with property management or property maintenance of that foreclosure property?
The ordinance calls for the bank to be responsible for the property maintenance. And if the property maintenance manager that's assigned by the bank does not maintain the property, then we will have all of our municipal tools available to enforce maintenance through code enforcement.
Okay. All right. Thank you.
Yes, ma'am.
Thank you.
Do we have any public comment? Okay, let me ask a procedural question. Paul, if Kristen just asked about specifying the size of a sign, I was hoping to vote to move this on to the council's agenda, but if we have to make an amendment, do we need to do that now, or can we amend the sign size after we move it forward to the council?
Councilman, without looking at it, you can always add an amendment in a council meeting. You wouldn't be able to put it on the consent agenda for adoption. I think Jarvis on your staff is talking with Adam, our executive counsel, on the procedure for doing that now.
Okay. Okay. Well, with that, no public comment. And can I get a motion to adopt this and move it on to the council agenda?
So moved.
Can I get a second?
For vote.
All right, it's been moved in second. Nathan, roll call, please. Yay.
Yay? I can't hear him.
Right? You got it right. Councilmember Nguyen?
Yay.
Three yeas, no nays, that passes and moves on to the regular council agenda. Thank you, folks. Do we have any additional topics, business, anything we need to discuss?
Hey, Jay, this is Jay.
Go ahead, Cindy.
Yeah, Nicole, let me ask you another question. How soon does the bank has to register once they go into foreclosure?
So that question, I believe, is within 10 days. If it is, I'm looking at the ordinance right now. I'm sorry, I don't have the answer. I think it's within 10 days, depending on whether it is a judicial or executory foreclosure, 30 days otherwise. So I'm going to have to get back to you on that, but it's pretty close in time.
Okay.
And Councilmember Palmer, also the signage is included, line 159 of the ordinance, and it is an 18 by 24 inch sign that is required, and it has to have the information of the property manager by telephone and email. And they have to be available between the hours of 9 to 5.
Okay. Councilman Banks, do you think we'll be able to see that from a car, you and me with our eyes?
Well, I'm a little older than most, but I think I might be able to see that. Yes, ma'am. So with that, we won't need an additional amendment. So this could go on the council's consent agenda, correct? Paul, you listening?
Yes, sir. It would follow the normal process if you don't plan to amend it.
All right, great. Thank you. Are there any further questions? I won't ask what the party is going on at Councilmember Palmer's house with all them people in the background, but I guess we didn't make the invitation list, Cindy, so c'est la vie.
Hi, team. This is our staff meeting.
Yes. Okay. Can I get a motion, please, to adopt the minutes from the last community development meeting?
So moved.
Second.
All right, roll call, please, sir. All in favor of adopting minutes, say aye.
Aye.
Opposed?
Aye.
That's done. So with that, folks, just want to ask everyone listening to remain very, very, very conscientious of the situation that we find ourselves in. Please continue to wear your mask, wash your hands, and social distance. We are on this road out of this, but the road is long, and we have to stay very focused on doing what we need to do to keep ourselves and all our families safe. I can't wait to get back to life as usual. So please, y'all help me get back to what I like to do, because I know y'all like to do it too. And wear your mask, wash your hands, and social distance. So with that, we are adjourned. Thank you.
Thank you.